All right, 5 minutes after 11 o'clock. Gosh, it's a really nice-looking Thursday. Temperature's a little bit cool today from what I hear, and looks nice out there. I haven't been out there myself. All right, let's see. We are about ready to learn again. This is what I love about this show, is you learn all the time, and Leah Caruso always brings in some great guests to help us understand how we can be healthier and feel better about our health. Leah is the Clinical Operations Manager for Strive Rehabilitation, and we're meeting somebody new from Strive, Barbara Dawson. Good morning, Barbara.
Good morning.
Nice to meet you. You are the I'm reading Robin's writing, Community Relations Director for Strive. Right? Did I say that right?
Pretty close, yes.
Okay.
I do community relations,
okay,
yes.
all right. Well, thank you, ladies, for coming in here. And you brought with you a handsome young man, and he's going to teach us about occupational therapy. He's Kellan Quigley, an occupational therapist with Strive. So good morning, all three of you. Thank you.
Good morning.
Thank you for coming in.
Absolutely.
So occupational therapy is always something I'm confused about.
Most people are, don't
because the word occupational, I don't know. Does that mean my job?
Under this scope of practice in occupational therapy, we refer to an occupation. It's a much more broad term than what most people think. Your occupation. Oh, thank you.
Look at his eyes, Robin. Does he got the actor's eyes?
Well, I am on camera as well, so this.
Yeah, you could.
I like your haircut too. I think it looks nice.
How do you like mine, by the way?
It looks good.
Robin did mine.
I think.
Yeah.
So when we refer to occupation, we talk about any activity that's meaningful to every individual. As far as obviously work can be an occupation. That's obviously a meaningful activity.
Yeah.
Leisure activities, what we call activities of daily living, ADLs. That's something you see referred to a lot in the hospital setting, where we help people acquire the prerequisite skills to be able to do basic things like dressing, bathing safely, being able to be mobile within their typical environment, whether that's home or an assisted living facility, wherever that may be. The goal of occupational therapy is to have any individual that has some sort of injury or dysfunction or impairment operate at their highest level of independence.
Because that's what was going to be my next question. I mean, I could come up with some obvious answers, but what would rob us of the ability to do those things? An accident, an illness?
Yeah, and it can be an accident, an illness. It can be repetitive use of your hand or your arm or your back at work. That can lead to long-term disability, short-term disability. That we will focus on any means in which we can get the individual to return to their prior level of function.
And who determines? Is it the patient, him or herself, determining that I'm not quite where I used to be? How do you know, for example, because I'm not a marathon runner, so obviously that wouldn't be something I needed to get back into.
Exactly, and it's a patient-centered approach. So that you're exactly right. It's the patient or the client. They are the ones that are going to say, hey, this is not my golf swing is not what it used to be. Is it my back? Is it my shoulder? Is it my arm? They go to the physician and say, listen, I'm having pain and stiffness. It's affecting my ability to participate in, again, let's say golf. That's the one leisure pursuit that that person really has enjoyment for. They may have some sort of physical limitation that's preventing them from playing, and go see the doctor, get a referral to a therapist. So it can be something on that level. It can be someone at work. They're unable to lift and carry boxes, or they've injured their hand. They realize I can't perform my job duties at the level I need to be again, and at that point they'd be referred to a physician and then to a therapist.
So is occupational therapy just for the people that are outside of the hospital, or does that happen inside the hospital?
No, it happens inside the hospital actually, and that is where occupational therapy started, was actually in mental health and acute care, so in mental health rehabilitation hospitals. In the hospital setting now, or acute care, somewhere like Ocala Regional or Monroe, West Marion, they all staff physical and occupational therapy services. So we see a lot of referrals in the hospital because, again, we want to make sure that people are able to go home and resume independent living. You can't make a safe discharge on a patient from the hospital, or if no physician's going to sign that sheet that says, yeah, that, you know, Miss Johnson's safe to go home. She's going to go right back to normal life, be able to cook herself meals, be able to get in and out of the car, get to the physician's office. That's when they'll consult occupational therapy to come in, do an assessment, see do they have the safety awareness, the functional capacity to be able to go home and be independent.
I would want to be so fast. I'm guessing people want to be fast in there. It's just not physically possible all the time. In other words, if I was, knock on granite, I'm not superstitiously, I promise. But, you know, if somebody told me, you know, you're not going to be able to fix your own dinner anymore.
Right.
And then I found out that you could help me change that.
Right.
I would want you to do it today. Okay. But how long does it normally take?
As far as to begin receiving services?
See, maybe my real question is about attitude. Because my attitude would be, okay, let's get working on this because I want to get back to normal right away.
Okay, I understand. So how long does it take typically for someone in the hospital to achieve that level where they can go home safely?
Yeah.
That depends. I mean, we see some patients that are admitted for chest pain. They may be hospitalized for 2 or 3 days, become a little bit weak. Obviously, when you're laying in a hospital bed, your opportunity to get up and move around and do tasks like you would at home is much more limited than normal. So
they don't let you get up?
They do, but it's their opportunity to do that is you can get deconditioned quickly.
I'd be helping out. I'd be getting. I would say, Doc, can I help you out with anything? You have any dishes? I'll clean them for you.
I'm going to bring you to the hospital, and you can talk to some of our patients then when
they
don't want to get up.
You're the best patient.
I will help you sweep the floor, or get the coins out of the vending machine. Anything. I love the vending machine in the hospital, by the way.
And Barbara, is that what you do as community relations? Do you find the people that are in the hospital that's going to need occupational therapy, and then you help them transition to a rehabilitation facility or to home?
The majority of what I do is out in the community. So he is wonderful doing what he does, within the hospitals, out in the community.
You could be an actress. You could be like an on-screen couple or something.
All right. Okay. Well, I'm out in the community, and I just remind the doctors out there that if any of their patients would need any of our services, whether it's occupational therapy, physical therapy, anything along those lines, they can refer to us because we also have our clinics throughout Marion County. So they can come to us, and we've got, everything that they would need there.
So they would come and see Kellan, and if they were in occupational therapy in the hospital, some of them after they transition, and they might still need some therapy outside of the hospital once they get out, they can come see us in the outpatient side. And then Kellan would be able to help them there as well. Because Kellan actually is one of our therapists that goes between both settings, the hospital setting and our outpatient setting.
Oh, really?
And occupational therapy is physical therapy in a sense then? Sort of?
It is similar with certain on a case-to-case basis. Our overall goal is a little bit different. Physical therapy has a little bit of a different, what we call frame of reference that they treat their patients from. Occupational therapy by nature is a little bit more of a holistic approach, but as far as what most people think of physical therapy, you're strengthening, balance, what the core of physical therapy is in most people's minds. We do incorporate that into treatment to achieve certain goals. Again, it depends on the patient.
So, see, you mentioned outpatient. See, I would prefer that. I'll come and see you. You work with me, then I'm going to go out and do something, right? Yeah. Right. I mean, that would help me a lot. I mean, I don't want to have to do any of this.
You don't want to not be able to do any of this.
Does insurance cover occupational therapy?
Yes,
it does.
And every insurance is obviously a little bit different, and it's different from setting to setting, inpatient versus outpatient. But typically, occupational therapy service is covered on an outpatient.
So is it possible that somebody's listening right now and they are connecting with what you're saying? but they're not in a hospital. How do they get the therapy? Do they go through Strive? Do they just come to?
They could. There's a couple different ways to get into treatment. As Lee had mentioned to you earlier, we do a 15-minute free screen, and if they call the main Strive clinic, they can set something like that up where they can see me. I can at least kind of put eyes on and get an idea of what they have going on. Typically what I see is upper extremity. So it's shoulders not as much, but elbow and hand related injuries, mostly on the outpatient basis. If they did have something that seems like there was an indication for therapy, I would basically send that screen to their physician and get an actual physician referral. Otherwise, what they can do is go directly to their primary care physician, say they have some sort of injury, again, the upper extremity. If they're having trouble with their hands, elbows, anything like that, they can talk to the physician. They will give them a prescription for therapy, which they can then take to the therapist.
And do you help the children that have to be in motorized wheelchairs, that they don't have very much control of any of their limbs? Do you provide therapy for them also?
Strive does not offer like pediatric
Yes.
rehabilitation for occupational therapy. Those would be occupational therapy. Absolutely does work with individuals, pediatrics in that sort of condition.
Mm-hmm.
That typically is a complete, very specialized clinic. It would have a much different setup than the clinic that we have at Strive.
You help the adults,
Yeah.
which are maybe 18 and older, or do you help like
Sometimes
16-year-olds? Because sometimes they have sports injuries, the high school football guys. And
Yeah.
Or they have hand surgery, or they got hurt, and
Actually, I have a gentleman I have to see this afternoon when I get back. That was he injured his fingers. High school football.
Oh, really?
Yeah.
Oh, gosh.
Who asks this question the most, or who tells you that, is it men or women? Will I be able to play piano after this? That's a joke. All men use, right? Don't all men say to you, well, and then they say, I couldn't play before. Never mind. I messed it up. I was distracted. All right. Before we take the break, Leah, you said there was a prize, right? Leah, right? Leah and Barbara. You have a contest going on.
yeah, we're going to do something special this month because it is Occupational Therapy Month.
Okay.
So what we wanted to do is we wanted all of our listeners out there on WOCA to go to our Facebook page, which is Strive Physical Therapy. So you want to go to our Facebook page, like us, and we're going to use the keyword WOCA. So if you like us and put in WOCA, your name is going to be entered into the drawing for the prize of this month, which is going to include a free 15-minute consultation with Kellan, grip strength testing, one of our own products called the Wonder Roll, some BioFreeze ointment, and a few other fun items, and probably with an estimated value of about $75. So we'd love to have you all go out and participate and like us on Facebook, and don't forget the WOCA.
So when you put your keyword in there, do you do that in the special message place or right on the Facebook?
We
page
have
itself?
a listing on the page, and you'll see the microphone, and it says "Listen to us." So there's an actual post on there.
All right.
So go ahead and hit comment, and in there, then go
Oh,
ahead
okay.
and write
Then
it in.
I write WOC. I'm going to start.
Yep.
I'm going to be the first one. Nobody's done it yet.
Good.
Okay, good.
WOC. All right. I just
Make
did.
sure you like us, and then you can put in your comment on the
All right,
on the
I did
tag.
it, and I did. Okay, so
Awesome.
Okay, I got to like.
And you
you're
don't have
first.
to
Oh, I'm
put your
already
name
like-
or phone number down there, just WOCA, and then you'll be able to contact them.
Right,
through
because
Facebook.
your Facebook will let
Then
us
you'll
know
know.
who you are, and then we'll let you know via Facebook.
Wow, I
if you
could
won.
win.
I
Yes.
tell you that Wonder Roll is wonderful.
Larry's eyes are
It
lighting
is
up.
good.
What is it? What is it?
that?
What is it?
Can't
It
wait.
is an actual item that is adjustable, that can go behind your back as you're sitting.
Support.
So it gives your lower back the support it needs to help you. You can use it. It travels with you, so you can use it on a plane, in your car, on a
Oh,
bus.
if you're driving in the car, you can use
It's
it?
great if you're driving.
Do you use it? Anybody use it?
At work? Oh, yes, I use it. Yeah. Helps with lower back pain. Ease it a little bit.
Oh, that's wonderful.
Definitely.
She's the only one who said she uses it.
I use it as well,
Oh, you
but
do?
some of them, some cars, if you have some cars now come with a little lumbar roll, so you might not need it in there, but you just want to make sure that you're putting it in the right spot, which we can definitely show you how to use it when you get it.
Okay, so like it and put WOCA on it, and then you will be in the running. And so far, I'm the only one. So go do this. You got to look for the microphone. That's a nice mic, by the way, on that picture.
I have a question about shoes, and this is about sneakers. When my daughter had broken her foot about 2 months ago, and then the doctor did what he did. She lives in Tampa to fix it, and she took therapy, and then she came back, and he looked at her shoes because she's on her feet all day because she's a surgical tech at a veterinary hospital down there. He looked at her shoes, at her sneakers, and said, "Those are the wrong ones. You have to get this brand." Do you help people out with that too?
I don't personally. I'm sure that Dr. Alec would be more than capable of doing that. Another thing that would really be a good question for a podiatrist, really. Mm-hmm. And even some of these stores now, some of like the sports stores that will, if you go in, they will actually have the staff is actually really knowledgeable about what kind of shoes. We're going to be more supportive if you're a pronator or you're an overpronator, which is basing how your foot, like the angle of your foot, that can affect your ankle and things like that. More often than not, especially if you go to some of the specialized running stores, they may be able to at least kind of guide her in the right direction.
Because they're good shoes. They're not from big box stores or anything.
Yeah, sometimes just because you're spending a lot of money doesn't mean it's the right fit for you. Mm-hmm. But our physical therapist also, Dr. Alec is one of our physical therapists at Strive that can definitely assess that and help out with that.
Oh, that's wonderful. So it's like a one-stop shop then, Strive Physical Therapy.
Absolutely.
We can see Kellan, and then you can refer the patient to the other doctor there.
Actually, so. Dr. Alec and I, we refer patients back and forth quite a bit. And it's the same thing with our chiropractor as well. We do refer patients back and forth quite a bit so that they're getting the most appropriate clinician for whatever their condition is or whatever their need is.
That's wonderful.
We're up against a little bit of a break, so let's take that break. We'll be right back. Kellan Quigley is here. He is the guest of Leah Caruso and Barbara Dawson from Strive Rehabilitation, and we will take your calls if you have any. If you have any questions, I should say, the number to call is 622-9622. We've got a little break, and we will be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. A front is going to be moving through with some showers and thunderstorms this morning. Then clouds will give way to some sunshine. It'll be breezy and cooler with lowering humidity some. The high 75 to 85. And then a clear, cooler night with a low of 47 to 55. Sunny with a breeze tomorrow. High 71 to 75. Sunshine, comfortable Saturday. High 70 to 75. From the Florida Weather Center, I'm Maggie Johnson.
Hey, this is Matt Wilkerson from Verizon. You work all day, right? So why would you want to spend your night out shopping for that new phone? Well, Marion County, let me and Verizon help you out. I can deliver to your home or office, saving you precious time. Phone, tablets, internet, home phones, even accessories. Whatever you need, we will deliver free of charge. Call me at the store, 352-528-0020. That's 528-0020.
Tired of looking at stained carpets, dirty tile, or grout? Call Silverback Restoration, 414-5312. Make your flooring look great again. Stains, pet odors, allergies. Call Silverback Restoration, 414-5312. From serving our country to serving our community. Silverback Restoration, 414-5312. Residential and commercial. Their work is guaranteed along with your satisfaction. Check their website, silverbackrestoration.com.
Stay informed on everything going on in the Villages with the Village Spectator newspaper. The Village Spectator is exclusively devoted to the Villages with news, commentary, and more. And yes, they have Tom's Picks, a free referral for people who are looking for a company to do work for them. Tom's Picks will refer the company that fits your needs, and all we ask is that you tell them where you heard about them. Call Tom's Picks at 804-1223 and pick up your copy of the Village Spectator today.
Now read Ocala Downtown newspaper online.
All right, 25 minutes after 11 o'clock. Let's return now. If you have any questions, by the way, the number is 622-9622. And if you have any more detailed questions, because obviously 5 minutes left, you might not, you might want some longer time. So call Strive Rehabilitation. Leah, do you want to give out that number?
Yes, our number is 351-8883. 351-8883.
I wanted to ask you something, Kellan. If you could do me give us a sense of what you do. Do you have any stories of somebody who came to you, for example, who maybe I was using play the piano as the joke thing before, but I mean, let's say they really did. They played piano and now they can't. Have you had anybody like that who had that kind of an amazing recovery where they then could do their normal things again? Maybe not piano, but anything.
Actually, I've had quite a few. The most recent one is actually a gentleman I'm working with now, and he's an old polo player, and he's a golf pro. He's
not going to like to use the word you're old.
Right. Say old. He's a retired polo player. He's an avid golfer. And he plays all the time. He's gotten to the point of where he came into me with a humeral fracture, which is it was a pretty bad distal humerus fracture, so right above the elbow, and it was completely shattered. He's gotten to the point where he could not move his hand or wrist at all. It was such a significant fracture that it not only prevented it from having range of motion in his elbow, his forearm, but some nerve damage where he couldn't move his hand at all. And he's still in the rehab process, but he now can almost make a complete fist so that he can manipulate small objects and things like that. He's actually using his hand, and he's gotten his golf game back. He said he shot a 94 the last time he went out. So he wasn't able to golf at all, and he's down to he's in the 90s again. So he's pretty happy.
So next time I do really poorly, I'll just say I'm still in therapy. Just use that as an excuse. Yeah.
You could.
Do you give therapy to people that have prosthetics?
Physical therapy does, yes. Occupational therapy, we would if it was an upper extremity. Very rarely do I see people with an upper extremity prosthetic. Actually, I haven't really seen much of that since I was in school in Western Michigan University. We had a clinic there where we saw people that came from all over the state of Michigan for prosthetic training and things like that.
Oh, okay.
So it's just in this area, in a larger city, in an inpatient specialized rehab, somebody may have had a bad accident would be. Most of that prosthetic training would go on in an inpatient specialized rehab facility.
And is occupational therapy also with speech?
Speech is a separate discipline.
Oh,
it is.
okay.
It is when we talk about rehab services in the hospital. We talk about speech therapy, physical therapy, occupational therapy.
Oh,
and it's a collaborative effort between all three disciplines to make sure one, you're mobile, you can basically take care of yourself, and then you can speak, eat, swallow, and be able to go home and thrive in your home environment.
Oh.
We're almost out of time, but I wanted to thank you. And just for the listeners, there's two parts to this, as you know, Leah. There's the live part, and then there's people who will see the video.
Right.
So what is the deadline for the contest?
Today.
So if you're looking at the video on April 6th, then you still have time to enter it.
Yes.
Right, enter the contest. And you do that simply by going to Facebook and then liking the page for Strive Physical Therapy Centers. And scroll down until you find that microphone, and then you have to leave a comment, which is what I did. So I started it, and then hit enter, because if you don't, then it won't be there. And then you could win the prize, which includes the lumbar, also known as the
Wonder Roll.
The Wonder Roll. Yeah. Okay. I'm hoping that somebody's listening who's needing occupational therapy. I'm just going to guess, because we kind of don't have enough time, but I'm guessing it's mostly from accidents.
I would say mostly from accidents, so like traumatic injury. which will see both inpatient, outpatient, and ORMC, where they have the trauma center, and repetitive like work-related injury. A lot of workers' comp. You have people that work with their hands all day. You're obviously very injury-prone there, so we see a lot of workers' comp, and even people that have done an elective surgery like a joint replacement in the hand.
All right. Barbara Dawson, nice to meet you.
Nice to meet you too.
Thank you for coming. And Leah Caruso, as always, you look beautiful. And thank you, Kellan Quigley. Thank you, Kellan.
I would be abnormal if you didn't get it wrong at least once. So
That's right. Everything is wrong at least once. Thank you all for what you do.
Thank you for having us.
We'll be right back.
Fox News Radio, I'm Lillian Wu. A change at the helm of the House probe into alleged Russian election meddling.
Chairman Nunes has offered to step aside as the lead Republican on this particular probe, and I fully support his decision.
House Speaker